Hello, I'm Benjamin Davis. I am a hip and knee adult reconstruction specialist. I practice in primarily the Hendersonville and Arden areas. I work out of both the hospital and surgery center setting. I have clinics out in Haywood as well as Brevard. So the anterior approach to the hip is when we go from the front, is what people hear, rather than posterior, which is from the back. An anterior approach is an approach that goes around the muscles, and so it utilizes a muscle interval that is already there, doing less damage to the muscles. With the posterior approach, oftentimes important stabilizing tendons have to be cut, and that can sometimes affect recovery for the patients. Key advantages of the anterior approach. One is less muscle damage. That's because we're going around the muscles instead of cutting through muscle. What this means is a quicker recovery and quicker return to your regular activities. One great advantage of the anterior approach with this quicker recovery is the ability to do these at a surgery center where you can go home the same day. Even in the hospital setting, oftentimes my patients will still go home the same day. Another advantage of the anterior approach is a lower risk for dislocation. This also means less precautions in the postoperative period, so less restrictions on your movement. Typically after an anterior hip, there are no precautions or restrictions. It is just advancing the activity, doing more walking, getting back to the things that you weren't able to do because of the osteoarthritis in your hip. Hip dislocation can be a very difficult complication. This is when a hip dislocates after a hip replacement. It's more common in an artificial hip than it would be with a regular hip that hasn't been replaced. One distinct advantage of the anterior approach is it lowers the risk for dislocation. The reason it does this is because it preserves all of the tendons that are important for stabilizing the hip. So a posterior approach, which cuts through those tendons to allow someone to put a hip replacement in, an anterior approach preserves all of those tendons, allowing for a more stable hip in recovery and a lower risk for dislocation after surgery. The ideal candidate for an anterior approach total hip replacement is really any patient looking to get back to activity quicker. So active patients, age-wise, it can be young or old. There's really only a few reasons to avoid anterior hip. That's usually patients with really complex deformities, which sometimes requires a bigger field of view, and so that sometimes requires a posterior hip. Sometimes much larger patients, depending on their body habitus, are better for a different approach. However, oftentimes if you have a discussion with your surgeon, we can figure out ways to optimize a candidate to ideally go through this approach, hoping for a quicker recovery and a quicker return to the activities they love to do. Anterior approach surgery is going through the front around the muscles. With this surgery, we typically used a specialized table that is meant for this surgery. It makes the surgery go more smoothly. It allows us to see the things we need to see to put the implants in most appropriately. And so with this type of surgery, with this type of table, it allows for a better surgery, a more efficient surgery. We're often using x-rays during the surgery for an anterior approach surgery. This differs from a posterior approach surgery where we're not able to see in real time what the bones look like, what the implants look like. And so doing an anterior approach allows us to visualize the implants as we're putting them in. One distinct advantage of having x-ray during the surgery is we can adjust how the implants are positioned during surgery. Oftentimes with other approaches that don't have x-ray, you're not seeing a picture of how the implants look until they're already in the recovery room. Well, if they see something they don't like, it's much more difficult to go and adjust it, whereas with the anterior approach, we're able to adjust it in real time. Hip navigation technology related to hip replacements utilizes optical tracking, preoperative radiographs, and sometimes CT scans. And what it does is it helps us optimize how implants are positioned. It also makes sure it's a patient-specific plan based off of that imaging to allow us to position the implants with the best chance of longevity so that the implants are lasting for hopefully the life of the patient. It also allows us to position them so it's the lowest risk for things like dislocation, which could be a tough complication if the implants are not placed correctly. Patient benefits of navigation technology, that includes better implant placement, which means longevity of the implant. So again, we're hoping for this surgery to be the one surgery we need for the hip and it lasts the rest of your life. This gives us the better chance to do that. It leads to lower complications, which means lower risk for dislocation and a quicker recovery for a more natural feeling hip. It also leads to more predictable outcomes. That way we're doing the same surgery, but we're optimizing it to the specific patient. And so the extra data points gives us more patient-specific data. So we are doing an individualized approach with the hip where the positioning and how it's done is optimized for that patient, and we have the data points we need to determine that. Key takeaways for hip replacement surgeries. The anterior approach allows for less muscle damage, a quicker recovery, and a higher likelihood of going home the same day or as an outpatient for this type of surgery. This also leads to a lower risk for dislocation. Building on that, utilizing the navigation technology allows us to customize how the implants are put in so it fits the patient and doesn't fit just a broader scope of patients. So each hip is individualized to the person, and this allows for a better outcome, quicker recovery, quicker return to the activities that you wanted to do and weren't able to do because of your arthritis before.